My name is Joseph Frasca, and I'm a gastroenterologist. I really see my job as somebody who's going to educate the patient on their disease state and really offer the best treatment options available to them. And ultimately, I always try to tell patients what I would recommend. There's a lot of options sometimes available for treatment, and I think patients often want to hear what you really think, and I really try to tell them that as much as I can and as best as I can, but ultimately the final thing I tell patients is that whatever we do is something that they have to be okay with and something they have to live with on a day-to-day basis. And after educating them and informing them on what we're dealing with, I really try to push them to be an integral part of the medical decision-making process. When I see patients with Crohn's disease and ulcerative colitis, what I really want to make clear to them is that while these diagnoses can be overwhelming for a patient and lead to potential complications that can create a lot of worry and anxiety for patients, there are a lot of resources available at our medical center. It's important to, first of all, decide how to manage their condition in the first place and how to best treat them. And I always have a thorough discussion with patients when we're talking about medical options for therapy. But one other thing that I discuss with my patients is the goals of our therapy and what we're really trying to accomplish. That can vary from one patient to the next, but very broadly speaking, what I ultimately want to accomplish for my patients is for them to really have as high of a quality of life as possible. I see a lot of patients who are relatively young and they're very productive people and very busy. They're parents, they work in the community, they're business people, and some of them even work at this institution. And what I'm ultimately trying to accomplish is to allow them to be productive members of their community without any interference from their chronic disease.